Respiratory virus surveillance data generates information, and this information can be on the current number of ILI or SARI cases. It can also be on the viruses that have been detected in these cases, or on the impact and the severity by risk factors. If historical data are also available, then thresholds can be generated, and these will help to indicate whether the current situation is normal or above normal. Also, monitoring and assessment indicators can be generated using this information to see how everything is working together and how we may improve the flow of information and samples. All this information can be organized in reports that are produced at scheduled intervals. Depending on the target audience, the message in these reports is adapted or chosen and then translated into public health actions, prevention messages, or structural actions for health promotion, such as the improvement of ventilation or the reduction of school ratios. We will give some examples of actions that can be taken by different roles based on various information produced by the surveillance system. An example of as source of information is a weekly bulletin that could be issued by a Ministry of Health, and this may be of interest to 1. Healthcare and community workers who can use the surveillance information to promote vaccination, or they can use it to recommend the use of masks in their vulnerable patients or in patients who have symptoms. And they can also use this information to guide their clinical management and community actions. 2. Decision makers can use surveillance information to plan, for example, for additional bed capacity in an outbreak and to guide their vaccination policies. Finally, people with at-risk conditions, the general public, and caregivers can choose to protect themselves by wearing masks or by asking for vaccination or by avoiding crowds. Consulting the regional and the global bulletin to check the status of transmission in neighboring countries can provide countries with valuable information to help them prepare for a new season or expand testing to new viruses when necessary. In this clip, you have seen the type of information that can be generated by the surveillance system and actions that can be taken using this information. Actions that include public health actions, the crafting of prevention messages, or including, at the highest level, health in all policies.